We are back and we are glad that you're joining us. Thank you so very much for tuning in. This is Nuru ya Asubuhi on Mizpah Tv, where we keep the fire of the altar burning 247. And today is Family and Health Thursday, and today we are majoring on matters health. We're talking about arthritis, and we are here just to understand what is it, what causes it, how can we prevent it, is it treatable? Those are the questions we are asking. We are here with the Dr. Stephen Musyoka himself. He is the CEO of the Clear Scan Medical Solution that is in Nakuru, and we are hoping soon there will be branches. Tunasema it's not only in Nakuru, we have other branches. Amen to that. And so karibu tena daktari, as we get to discuss more. You've told us what happens, what it is, what are the types, some of the general types, the major types that we have, and also you've talked about some of the things that can really affect it. And so there's one person who is asking, anauliza daktari, kutembea sana kwa miguu kunaweza leta arthritis. That is the one you've mentioned, the wear and tear. Yeah, we can start off with answering that as we continue.
Now, I would want to answer that now in what we were to talk about next. That's a predisposing
risk factors.
Or the risk factors.
Okay.
What are some of these things that if you do them, you are likely to develop arthritis?
Yes.
So that question will be answered in that. I would emphasize on it when you get to that. Number one thing that is a risk factor is family history.
The family history.
Family history. Okay. Yeah. You find that in your family lineage, there are people who have had arthritis. So if your grandfather, your grandmother, your mother, your dad, they have suffered arthritis, there is a likelihood that you are likely to suffer arthritis. Likelihood. There's a probability. That is not a guarantee that because your father had arthritis or your mother and your father had arthritis, everybody in the family must suffer. Yes. We only talk about now the genetic predisposition. Okay. There is some aspect of genetic predisposition. So if you know that your parents had that kind of a problem, keep on be on the lookout because you're likely to suffer arthritis. Number two thing that can predispose you to developing arthritis is sex. So what is your sex? Is it male or female?
Hey.
Yeah, it is documented that you are likely to suffer arthritis if you are female more than if you are male.
Yeah, we are at a higher risk.
Yes, women are at a higher risk of developing arthritis as compared to men.
Could I ask why?
I think it's just the genetic makeup, as I said. And again, you look at the way we are structured and the activities that we do.
Oh, we get.
Women tend to do a lot of activities and men. And two, you're likely to find more women with issues of weight as compared to men. Not that men don't have issues of weight, but it is just recommended that sex. If you are female, you are likely to develop arthritis more than male counterparts would develop arthritis. The other thing that is likely to predispose you to arthritis is obesity. Yes. Okay. As I have just mentioned before, weight, the issues of weight. So if you are obese, you are putting a lot of weight on your joints. Constantly for a long time. So what is likely to happen is that now the rate of tear and wear increases. Remember, I told you that when we were in break that the tear and wear is not something that will happen over 1 week or 1 month. No. It's a progressive thing.
It will take years.
It will take years. That's why you will not even notice when it starts to set in. You will only notice when it is too late. It has already damaged the joints. It's good to understand that that it's a progressive thing. It's something that is going to start here and it's going to end here, but it's going to go slowly. It's a progressive thing. So obesity, what happens that when now you have a lot of weight when you stand up, for example, you are exerting a lot of weight on your lower back, you're exerting a lot of weight on your hips, you're exerting a lot of weight on your knee joints and your hand joints. So obesity is another risk factor. Now, the other thing, you could call it history of trauma. yeah, ama joint overuse, depending on what you do in your life.
Okay.
Yeah, if you get injuries on joints, maybe during sports, or maybe you just get involved in an accident and then there's a trauma that affects the joint, it might heal completely at that point in time. But that has already started the issues there, the inflammation. Now the tear and the wear starts. So later on, you'll develop what you call post-traumatic arthritis. There you'll have arthritis, yes, but it's because you had trauma to that joint, right? Now, when you talk about the joint overuse, is recurrent traumas. You overusing the joint, and you're doing some sports, you overuse that joint. So there is a small trauma that is happening to you without your knowledge. Those one now can affect you. Okay, somebody asked about walking a lot. Walking a lot is not a problem. The only problem is if you get now trauma when you are walking, right? Or you are carrying a lot of things, or you are extreme. If it's extreme, yes, but the normal walking, in fact, it's good. We encourage
I think he's talking about, I think my guest, my viewer, thank you so much for sending that question. I think kitambo najua venye watoto walikuwa wanaenda for almost 30 kilometers to school and all. I think that was his perception. Like umetembea, you are not supposed to walk that much.
No, that is not a problem.
That cannot
is
cause.
not a problem.
Okay.
Do not cause. Do not cause you, unless it's extreme. You know, you know that walking of kukimbia shule kurudi. That's no more. That's no more. It has to be extreme for it to say now you are walking as to cause you these are the problem of arthritis. Now the other things that will predispose you to this arthritis, maybe now you get joint infections, right? You can have joint infections that will now start destroying the tissues and the structures around the joints. Yeah, so those are some of the things that will happen to you, and you will be at now risk of developing the arthritis.
Okay, and also age as you progress.
Yes, his age was supposed to be number one. I don't know, because we had talked about it. I thought I talked about age. Age is number one thing when it comes to developing arthritis.
Yes.
Age, advanced age. That's why we have to, I think the progressive thing. This thing starts when you start to grow old. Okay. And it's because now you are using your joints as time goes by. So as the age advances, then you are likely to develop arthritis if you have advanced age. There is no specific time.
Oh, I was about to ask that.
And like when you start getting to 20, or you start getting to 30, or you start, no. There are people who start having problems as early as 30s.
Arthritis as early as that is.
In fact, for rheumatoid arthritis, it can start even in young children.
Whoa.
So for rheumatoid arthritis, that's a different thing. That can even start when somebody is very young. It can have it in children. But the osteoarthritis, without any other predisposing factor, is likely to start now with advanced age. That's what I was telling you. It's not very easy to say that when you get to 30, you start getting ready. No, I've seen people who have very bad arthritis at 40. I've seen other people who are at 60 and they still have very nice joints, right?
Yes, that's
true. Yeah. So it's not, you cannot say a specific age, but you get to middle age going forward. Because of the tear and wear now has accumulated over these years you have been growing. Now the symptoms start to show up. So age, I don't know if that was number one thing.
Yeah. Okay.
So age, sex, obesity, family history.
Okay. And I ask about obesity. Is it sometimes you find that people who maybe they overeat, and those who it has come from the genetics. So obesity unaweza pata it's both. Mwe umejileta by your lifestyle ama imetoka kwa familia.
Either of them, because what we're talking about here is the weight effect on the joints.
Okay.
Yeah. Either it comes, your bad lifestyle habits, or it has some genetic predisposition.
Yeah.
Either way, the outcome is weight. So this weight is putting more weight on the joints. So you increase the rate of tear and wear. Yeah. So now with that information, now you know what you can do. You're starting to know what you can do to either slow down the progression or control now the symptoms that you may be presenting with. And now because there is more to lifestyle to it, then you realize that there is still to work on in trying to prevent
Okay.
Not even to prevent, to slow down. In fact, the best word is to slow down the progression.
Okay.
Because tear and wear, tumesema, gari ikiwa kwa barabara, mguu lazima itaisha.
That is so true. That is
yeah,
so
but
true.
now, if you tatembea sana, mguu itaisha haraka.
Yes.
Yeah, so that is what you need to know, to know, so that you now prevent the progression or the slow down the progression of the disease, the osteoarthritis. Yes.
And so some of the things, because we cannot change our sexes, like you're either female or female, but kumeharibika hii dunia. Anyway, apart from that, there is now these other things. You are talking about the lifestyle. We need to be careful. Some of the preventive measures we can use.
Now, what we can do to slow down, because I've said it's just slowing down
Yes.
the process.
Yes.
We now go back and look at our lifestyle, right? So, if you are obese, of course, number one thing is to lose weight. Don't wait to gain weight to lose. That's what I tell people. Don't wait to lose to gain, then you work on it.
Yes.
Work on it before it comes.
Okay.
Because it's not easy. Truth be told, it's not easy to lose weight once you have gained the weight.
Yeah.
And it's usually physiologically, once you get weight to a maximum, for example, say you have had weight of up to 100 kgs, the body sets that as a set point. So that is the set point. Every time your body will be trying to achieve that weight. So even if you lose it now to 70,
Bad the goal.
your body to be targeting 100, because that is a set point.
Where? Okay.
So don't go there.
Yeah.
Because when you take it there,
Yeah.
your body will always be trying to take you there.
Yes.
So prevent that.
Okay.
Don't allow yourself to get the weight that you don't need.
Okay.
Right?
Okay.
And the other challenge that you find with people who have had issues of weight, you found yourself there, okay, you did know, now you know that weight is not good.
Yeah.
You try to tell them then like, but I'm comfortable the way I am. I agree with you. You are 20. You are comfortable. Your joints are still okay. You don't have a problem.
Yeah.
I don't have a problem with that. But remember this one thing. Slow progression. It's a cumulative thing. Because of the weight you're putting on your joints are straining. They are wearing down. You are not noticing it. Your rate at which the joints are wearing down, it's faster than the person whose weight is slow, is less, right? So you are just accelerating it. So in a few years' time, you will start complaining.
Oh, in a few years.
And it will be late because the problem is already in. So what you need to do? What you need to do is prevent it. Make sure that you do don't add unnecessary weight. If you're doing your exercises, they have to be the correct exercises. If you're doing sports, then you have to do your sports in a way that you are also taking care of yourself. Don't get yourself hurt, because you hurt yourself now. You're putting yourself at that risk. If you are female, you cannot change that. The only thing now you can do is now the lifestyle now I'm talking about. Yeah. If it's rheumatoid arthritis, for example, I said that one you don't have any control over. The only thing that you can talk about now is how to control the pain. But generally, osteoarthritis, you can control it or slow down the progression by checking your lifestyle. If it's about gout arthritis, or you avoid the foods that usually are rich in uric acid. Yeah. So, and you know, if your family it has been there, then you know. And you see now there are other conditions that are lifestyle related. For example, diabetes, which can also predispose you to or can accelerate the joint destruction. So again, that's a lifestyle disease, which you can also prevent by modifying your lifestyle, the foods you eat, the type of exercise, your level of exercise. Yeah, because again, if you don't exercise, then you're putting yourself at more risk to all now these other non-communicable diseases we are talking about nowadays. You know, in Kenya we used to talk about infectious diseases. Now we are talking about the non-communicable. It's very simple. It's none. Hakuna mtu amekuambukiza. Ni wewe tu. So yeah, so you can take care of it by just improving your life. But all that said and done, you've come, you have now arthritis has set in. What do you do?
Exactly. Next question.
Now, what we do basically, we just do some investigations. Some investigations might be knowing what you arthritis or you have osteoarthritis, for example, but we still do other investigations to make sure that you don't have the others. So, or we just be very sure that it is this one we are dealing with. So we might do some lab works. We can do blood tests. Blood tests will tell us if you have rheumatoid arthritis. We'll check for uric acid. We can know if you have the gout arthritis. Or we can also do some aspiration. If the joint is swollen, you can take some fluid from there, pelekwa lab tujue kama ni infection uko nayo kwa hiyo joint. That is septic arthritis. Yeah, so there are those lab works that you can do to try and check the arthritis thing. Then now the other thing that can be done is the imaging. The imaging here means X-rays. We can do the X-rays and then you'll be able to read this. Okay, you joint is straight, the surfaces are very rough, you have now the spars, you have the osteophytes that are making the joints very rough. So the other thing that you can do, we do, is usually the CT scan. The CT scan, depending on what you want to look at, it gives us more details. Especially now we talk about the knee joint. The knee joint, usually talk about it as the most complex joint in the body. It has so many structures in it. Hapa tu kuna tu vitu twingi sana. So if you want now to get more details of that joint, you do the CT scan, or even better, you do an MRI. But now that will be dependent on how you present. You know, you cannot just come and you campaign 1 month alafu I send you for an MRI. It's expensive, of course.
Exactly.
And so it will depend on how you're presented. If you present in this way, I'll know which one you need to do, which one you can't, or where do we need to start. At least to have a baseline. You can also do an ultrasound. We also do what you call musculoskeletal ultrasounds for the joints. You can also tell, or you want to aspirate now, as I was telling you, want to get that fluid, you want to guide, there's something I want to get that fluid for test, you can do an ultrasound, what we call ultrasound guided aspiration. You aspirate that fluid and then taken to the lab for investigations. So those are some of the ways, or some of the investigations that you do. Now, once we've confirmed, now the arthritis is there, then the question is, how bad is it?
Oh, that's the next question.
Yes, how bad is it? Now you have found you have arthritis. Yes, if the arthritis you have is not so advanced, then, and you have a lot of weight, now we can now start talking about reduce your weight. Now we recommend exercises to control the pain.
The exercise is to control the pain. We
recommend, depending on how bad the condition. If it's not so bad, then we can give you now the medication to control the pain, what we call non-steroid or the anti-inflammatory drugs, because majorly what is happening there is inflammation. So we call them non-steroid or anti-inflammatory drugs. We can give you that. Then we can combine that with the physiotherapy. We'll tell you some of the exercises that you need to do. They relieve the pain, right? Then if it's weight, we tell you to reduce the weight. If it's rheumatoid arthritis, that treatment is completely different. Then you can also do the investigations and find that the joint is so destroyed. If it is so much destroyed, then you can think about surgery. Now, surgery, again, it depends on what the extent of the disease. You can do the surgery to try and to get the osteophytes off, or you can do now the surgery to do what we call a replacement, especially for the knee and the hip joints, what you call knee replacement and knee replacement. That damaged part you get and put on what you call a prosthesis, and then which is now smooth. So you're putting something that is foreign and that is smooth. So that is now the surgery, again depending on the severity. So for the hip, it can either be partial hip replacement, or we can have what you call a total hip replacement, depending on the extent of the damage. See, now, so we have talked about the drugs, we've talked about the physiotherapy, the lifestyle modification, we've talked about the surgery, but there are also other things that can relieve pain at home. Like the exercises. Then we have some topical drugs you can also apply to try and relieve the pain. So basically, this one we discuss when, depending on
the disease, the arthritis that you get,
the one you have, and the extent. Then if it's now for the rheumatoid arthritis, we give some things, drugs we call the DMARDs. They modify that, they confuse the body reache kuona mwili yako sio yako. We give DMARDs. If the pain is too much, again we also try to give some steroids, but again it depends. The treatment is usually individualized. Don't go and say like my friend went akadungwa dawa. No, it is yako iko aje.
Personal.
Yes.
Okay, that is why they need to visit ClearScan. Yes,
we can visit ClearScan. We sit down and we discuss what we need to do, because the treatment for every person is individualized.
Okay.
Yeah, you don't go there and tell daktari rafiki yangu alikuja na arthritis na akaekwa chuma, hata mimi nataka chuma.
Strictly daktari, I have come for the chuma.
Yeah, you don't come like that.
Hata ujui ugonjwa wako ni upi.
Exactly.
Oh, this is so nice. So in short, to change life yetu, we were talking and we were discussing tukiwa break note, we said that it is important from early age tuanze kujichunga, tusigoje ikiwa worse, you know, ati tunagoja wakati imefika huko ndio unakumbuka haya uko at 50 40 ndio unasema na baadhi watu wanafanya exercise na ulijua tu ukiwa hata teenager.
Yeah, you knew.
Exercise is important. So I think we need to be better our lifestyle, because we are the way we are living, you're telling us is it tunaishi vibaya zaidi.
Yeah, we are living badly. We're living badly. We need to change. We need to change.
Yes.
Like change everything, because you see now once osteoarthritis has set in, it's not reversible. The joint has been destroyed.
Yeah.
You can only now slow it from the time you umejua niko na arthritis. You can only slow down the progression from there, but you can't really change it at ikweza hauna.
Yes.
It will still be there. Okay. We only control the severity or the severity of the symptoms that we're going to do. So lifestyle lazima to change. Hatuwezi kaa tu. Tusikuwe kaa tu na kukula. Yeah. Siaribi watu wa motorbike kazi lakini watu watembee.
Awesome. And also there's this concept of getting to understand that it is good to go for the is it called kwenda checkup? You know, every time. If I go for checkup like at my age, can it be spotted that Emily, kuna signs maybe in the future you could have?
Yeah, definitely. When you go to the hospital, we usually say that a good clinician will take a very good history.
Okay.
We'll ask you so many questions that mnasemanga tunakuwa na swali mingi.
Kawaida.
Definitely. After that, we now do what we call general examination. No. So if you come and tell me, I'll ask you those questions, any joint pains, any stiffness, or blah blah blah.
Yeah.
Then, if I will ask you what we call family history. Family history, that's what the question you ask. Is there anybody kwa familia yenu anakuanga na ugonjwa fulani, unaona? If you tell me yes, my dad, you know, was treated for arthritis and has been having a very bad one, we will have to examine you.
Yes.
When we do the examination, there are some of the what we call the signs that we usually elicit. So if, for example, I examine your knee joint, then I find there is a reduced range of movement. I examine your joint, I get that grating sounds coming from there, we call it crepitations. Then I'll tell you, kapa joint, kuna venye kanalia. Si kazuri. No. Then I will start, we can now think, is it too bad to warrant an X-ray so that we